Heart attacks remain one of the leading causes of death worldwide. But the good news is that the body often gives us early warning signs, if we pay attention. Today, we'll talk about 10 warning signs of a heart attack that you should never ignore, as recognizing these can literally save your life. The most classic and well-known symptom is chest pain or discomfort, often described as pressure, squeezing, fullness, or a heavy weight in the center or left side of the chest, and it may last more than a few minutes or come and go. However, not all heart attacks present with severe pain. Sometimes it feels like mild indigestion, which is why it's often missed. The second major warning sign is discomfort in other upper body areas such as the arms, back, neck, jaw, or stomach. This pain may be dull or sharp and can radiate in waves, especially to the left arm or jaw. Third, shortness of breath is another red flag, and this can occur with or without chest pain, sometimes even when you're resting or doing minimal activity. Fourth, you might experience sudden, unexplained sweating, what we call a cold sweat, because the body is under stress and adrenaline levels spike when the heart struggles to pump blood. Fifth, nausea or vomiting, particularly when combined with other symptoms, should never be ignored as the heart and digestive system share nerve pathways, leading many people to misinterpret this as food poisoning or acid reflux. Sixth, unusual fatigue, especially in women, is an important but often overlooked symptom. Feeling drained, exhausted, or weak for no apparent reason, sometimes days or weeks before a heart attack, is a sign the heart isn't working efficiently. Seventh, lightheadedness or dizziness, which may make you feel like you're about to faint, is another critical warning, as it signals reduced blood flow to the brain. Eighth, palpitations or irregular heartbeat, especially if sudden and associated with discomfort, can indicate the heart's electrical system is struggling. Ninth, swelling in the ankles, feet, or abdomen, though more often associated with chronic heart failure, can also appear in the context of a severe cardiac event. Lastly, a sense of impending doom or unexplained anxiety is surprisingly common and should not be brushed off as just stress, especially if it's combined with physical symptoms. Women and diabetics often experience what we call a silent heart attack, where symptoms like fatigue, indigestion, or mild discomfort replace the typical crushing chest pain. So it's important to be extra vigilant. If you notice any combination of these signs, do not wait. Call emergency services immediately because every second counts in reducing heart damage and improving survival. Early treatment with medications like aspirin, nitroglycerine, or life-saving procedures such as angioplasty can make a huge difference, but only if help is sought quickly. Also remember that risk factors like high blood pressure, high cholesterol, diabetes, obesity, smoking, sedentary lifestyle, and high stress increase your chances of a heart attack, so managing these is equally crucial. After we discuss these symptoms, I strongly encourage you to share this information with your loved ones because awareness is the first step to prevention. In the next part of this channel, we'll also cover how to reduce heart attack risk through diet, exercise, stress control, and regular checkups. So stay tuned and subscribe for practical heart health advice that can save lives.